Let's go into a little bit of anatomy. So first of all, when we're thinking about the general composition, it is fibrous and fatty tissues, milk glands, and ducts. That's sort of, the big kahunas of the breast. No pun intended there. But that's like, it's a variety of soft tissues. Breasts really fundamentally are designed to feed babies as well as other things. So they have a lot of milk glands and ducts. The glandular tissue is very fragile and it's easily damaged. So if you use a lot of pressure on the breast, you may actually end up damaging the glandular tissue, which you're not intending to. You're just not aware that it's actually very fragile. So you have to be gentle with breast tissue. It does have extensive lymphatics, and the lymphatics primarily drain laterally. They do drain medially as well. They cover the whole of the breast. The lymphatic flow goes around to the back of the body and then up the nose on either side of the spine. But their primary area that they drain is to the axilla and then up here towards the subclavian area and then back down in through the circulatory system here. And then it's excreted out of the body or sort of returned to the circulatory system. Blood supplies, it's very extensively supplied with blood. And interestingly, a lot of the arterial blood is really early off the heart. After the lungs, it's the first area to be receiving blood in the body, excluding the head. But if you're thinking about the trunk, the lungs get the first blood from the heart, and then the second is the breast. And the reason for that is because these are important glands. These are important structures in the human body. They help regenerate the next generation. They help keep the next generation alive. They create the instinct for mating, for beauty, for connection. And their symbolism is all around love and nurturing and care. So nature was like, we need to make sure these organs have the best options available. So they gave extensive lymphatics so they can be nice and clean, extensive arteries and veins with some of the most oxygenated blood in the body. And then the blood supply comes mainly medially. It does come laterally. It's not that it doesn't come laterally, but more blood comes medially. And then when you're leaving the breast, more blood leaves on the medial side as well. So blood supply, you get more activity medially. Lymphatic supply, you get more activity laterally.